What conversation should you have with clients about their restroom supply preferences is to ask directly how they want partially used items handled and document their rules. Begin by asking whether clients prefer half-used rolls kept, quarter-used rolls discarded, or if they want any partial disposables saved for later use, and write their preference down exactly as spoken. Explain how keeping partially used items affects inventory, storage space, and potential cross-contamination so they understand trade-offs. Offer concrete options such as keep halves only, discard once tissue is unwrapped, or place partially used items in a designated sealed bin for reuse so they can pick the approach that fits their risk tolerance. Describe how to label and date saved items using a simple sticker and the initials of the cleaner to maintain accountability and rotation. Advise scheduling a quick monthly check-in to confirm the policy still fits their needs and to adjust par levels for supplies accordingly. Teach staff to follow explicit client instructions on site notes and to photograph or log any unusual situations immediately so there is no ambiguity later. Common mistakes include assuming standard practices apply, which leads to conflict. Avoid this by always asking and recording the client preference at the start of service. Another is inconsistent handling by different staff members, which causes mixed expectations. Solve that by adding the preference to the job checklist and verifying at shift handover. A third is failing to communicate supply shortages or excess, which disrupts workflow. Prevent that by setting minimum reorder points based on the client preference and sending a brief weekly update to the client when usage deviates from the norm. BigHomeProjects.com helps homeowners find trusted local contractors and helps contractors find work by listing projects and preferences so both sides can match on details like restroom supply policies. We also host a discussion community where members share practical advice, ask questions, and refine expectations together.